like to pass off the discussion now to Dr. Joel Charles and his wonderful little assistant. Thank you.
This is Juniper. Yeah, Dr. Newman, I appreciate you bringing up the storm of August 2018. My first son, Finn, was actually born that night at Gunderson, and I practiced in the Kickapoo River Valley, and a lot of my patients were flooded out of their homes. So that's a very meaningful memory for me and something that really motivates me to be here today. As a family doc in Crawford County, I got into medicine because I wanted to help people who were struggling. I'm here this morning because there's only so much I can do to help my patients from my exam room. I'm here right now because policymakers are deciding in the next few weeks whether my patients will keep breathing dirty air or can breathe easy and be healthy. I'm here because if we get this moment right, if we can clean our air by transitioning from fossil fuels to clean energy, we'll achieve profound and local health benefits. My patients will breathe easy. From the moment of conception to their last breath, Wisconsinites are made sicker because we get our energy from fossil fuels. Fossil air pollution causes stillbirths, preterm births, delayed cognitive development in children, asthma, heart attacks, cancer, strokes, and dementia. We are all impacted. At least 100,000 Americans die every year from fossil air pollution, and that may be a severe underestimate. Fossil air pollution costs America at least $820 billion a year in healthcare costs and decreased productivity. That is a staggering price to pay. But we don't have to pay that price anymore. The blueprint for something better is simple. Electrify everything we can, especially transportation, and produce that electricity in state with clean energy. If we do that in Wisconsin, it would save nearly 2,000 lives every year. Electrifying transportation is a key foundation on which to build that cleaner future. A lot of progress has been made at decreasing pollution from the transportation sector, but it's still responsible for 20 to 40,000 American deaths each year. There's a better way. To get there, we have to electrify our school buses, our transit, our shipping, our public and commercial fleets of all sorts, and our personal vehicles. And we need all those vehicles running on clean energy produced here in Wisconsin. Because diesel vehicles have been particularly difficult to clean up, we should prioritize electrifying medium and heavy duty vehicles, especially city transit and school buses. Every day around Wisconsin, hundreds of thousands of children board buses to school where they're supposed to learn. But on that trip, their growing lungs and brains are exposed to unsafe levels of diesel pollution. They breathe air that we know delays cognitive development. This was the price we had to pay when we had no alternative, but electric school buses are ready for prime time. There's no justification to delay this transition. Supporting the electrification of Wisconsin school buses should be a top priority. Air pollution doesn't respect urban-rural boundaries either. There's not a community in the state that isn't impacted by it. This is a rural, suburban, and urban problem. But the transition to clean energy is also a rural opportunity. Rather than paying to ship in oil, we can power our EVs on electricity produced in rural Wisconsin. This is a major opportunity to create rural jobs and boost township revenue that keeps schools in places like Soldiers Grove open and roads repaired to get urban money flowing into rural towns. This is a win-win for all of Wisconsin. Everyone wants clean air and clean water, affordable energy and transportation, and good-paying jobs. The transition to electrified transportation powered by Wisconsin-produced clean energy can deliver all those benefits if we get the policy right. So let's do it. Let's build a state that is healthier, wealthier, and more united. That's why Wisconsin's doctors are thanking Ron Kind for his leadership and asking him to go big on clean transportation.